Most people, when they get diagnosed with cancer and become cancer patients, they look to their physicians, or they look to their policymakers, or they look to groups like CAGLA to be their advocate, to advocate for them for the best health care, the best cancer care they can possibly get. But most people aren't Skeeter Salim. So Skeeter Salim is a nationally known toxic tort attorney based out of Houston. He's the managing partner of a firm called Salim Beasley. And Skeeter, rather recently, was recently diagnosed with stage 4 throat cancer. They found a really big tumor on the back of his tongue, and his doctor at the time, his oncologist, said, you need to get the proton beam. I know a lot of people in this room are probably familiar with that, the new radiation treatment called the proton beam. And so the only problem was his insurance denied it. And so the thing with the proton beam is that it's a very precise radiation treatment, so there's a lot less collateral damage when you receive that treatment. So obviously, if your doctor's saying you should get that, that's what you should get. But the insurance company denied it. So as one person said, like the insurance company kicked the wrong ant pile, because after Skeeter decided to pay for it out of his own pocket to get that type of treatment that was recommended by his oncologist. And once we're happy to say he's in remission now. And once he was in remission, he said, look, I'm going after the insurance companies. And that's exactly what he did. He was his own personal health care or cancer care advocate. He basically did the work of what, CAGLA with 30 scientific advisory board members and 7 trustees are doing now. He did that. And the work that he did himself is benefiting all the cancer patients today. So we are super, super excited to have him. The way that we came across Skeeter, if you were to Google his name, there's a ProPublica article that was written on Skeeter and his when he was a healthcare equity champion, and it got over 10 million hits. And one of our scientific advisory board members forwarded it to me. He said, "Do you think we can get this guy to be a keynote speaker?" I said, "I'll do everything I can to see if we can make that happen." And so we're very fortunate. He's agreed to come and speak today. So I'd like all of you to give a very warm welcome to Mr. Skeeter Salim. Thank you.
Chad told me he had invited 32 other people to speak, and they'd all turned him down, so that's how I got here. Man, I'm really honored to be here. I can't tell you how much, because I think we're going to share some goals together on what I personally believe and what I know what you're working on and doing, and I think maybe we can be of benefit to each other in this fight. As Chad said, my name is Skeeter Salim. I'm a 47-year trial lawyer out of Natchitoches, Louisiana. I live in Houston with my beautiful wife, Melissa. My 2 law partners are here, Barrett Beasley and John Alden Mead. I don't know. They must have had nothing to do today. But I'm very honored to be here. I want to share one thing with you. Do you love this tie? Valentine's Day, my wife walked in and I handed her a beautiful piece, and then she goes, "Oh shit, it's Valentine's." So she went to Rite Aid and she got me this tie for Valentine's Day. So thank you, baby. I love this tie. My story of surviving cancer and the unexpected legal challenges I faced have changed my life. My voice is raspy and goes back and forth, but other than that, everything's great. When I first heard about CAGLA's work, including their successful lobbying efforts to help patients, I said, wow, this is a really good deal. And I enthusiastically accepted Chad's invitation to speak to you. Their vision to reduce, the physical, financial, and emotional suffering associated with cancer is what I think we all should strive for, and I know that's why all of you are here. So I thank you, CAGLA, and I thank you, Chad, for the wonderful work you're doing. The thing about it is, though, is the law stacked against us. When it comes to paying for insurance, when it comes to cancer treatment, it's against us. And by that I mean there's a law out there called ERISA, and it was formed in 1974. And what ERISA basically says, and we're going to get into the weeds on it a little later, but it says the insurance company's correct. Whatever they say is correct. You have to disprove what they're claiming. The system is totally stacked in their favor. You can't file a lawsuit in state district court because it's what's called preempted. Preempted means federal law applies over state law. So rather than a person who's been harmed and needing to have medical treatment, you can't go straight to court, get an injunction, order them to do the medical treatment. No, you have to go through ERISA, which means you have to file in federal court. You have to go in front of a federal judge. You're looking at a minimum of 2 years before you could possibly get a ruling. So it does you no good. What's this person supposed to do during the 2 years? And if you should happen to die, guess what? Under ERISA, your claim goes away. So it is a horrific law. We're going to go into what I think we can do as a group to do some good on this. But just basically about my story, guy contacts me from ProPublica and says, hey, I want to do a story. I said, on what? And he says, on your ERISA claim. And I said, nobody's going to be interested in that. I said, I'm a little lawyer in Natchitoches, Louisiana that had a case against Blue Cross. Who cares? Well, obviously 10 million people did. Because what I found out after over 5,000 people contacted me directly asking me if I could help them with their problems with insurance, I realized that every family almost in America has faced a problem with an insurance company at some point in time. I mean, everybody I talked to, whether it be an aunt, an uncle, a dad, a son, had dealt with the same problem. I was insured by Blue Cross, and then I filed a lawsuit against them in Natchitoches after my treatment was over with. Well, then looking at my policy, it was ERISA, so I got dragged to federal court. My good friend Ronald Corkin, who I grew up with, I said, I can't represent myself. You're going to have to sign the pleadings. And he said, well, if Barrett will do the legal work and you'll stick in there, we'll do it together. So we took on Blue Cross and we took on ERISA. I had my claim turned down 5 times during the ERISA process in 19 days. Now, why is that significant? It's significant under the ERISA law that if you don't file all the appeals, you can't even file suit. You're done. And if you don't file suit within the time frame, you're done. And if you don't file the appeals during the time frame, you're done. Well, all the great nurses and doctors and medical suppliers and healthcare, how many times does a patient worry about that at the time? They're trying to have you save their life. They have cancer. They don't care about an appeal process. They want the treatment that you can provide for them. They want to live. How do we educate all these people? Excuse me. I don't know the answer to that, but I know the systems are broke. And I know and I'm talking about people that care about cancer victims, people that treat cancer victims, they know what they go through. Now, the solution is not you doctors and not you nurses. You can't possibly do what my doctor did. And hear me out on this. He really felt strongly about proton radiation. He filed a 255-page appeal. He put article after article, and still we didn't win as far as Blue Cross is concerned. Who in your office can spend 5 days researching and do a 255-page? You've got cancer patients to treat. You got people to look after. You got people whose lives are in your very hands. You don't have time in your office, doesn't have time. So what do? You do everything you can to try to get them the treatment they need. But how many times, and everybody in this office, how many times have you had to do an alternative method or an alternative treatment that you didn't want to do because that's what the insurance would approve, not what you wanted to do, not what was in the best health of your patient, right? It's not fair. It's not right. But it is a system under ERISA. The reason I wanted to do the proton radiation from Dr. Fuller is because they were telling me all of the issues I could have: memory loss, I could have speech loss, I could have gland issues that the proton radiation would help. Initially, when I went to MD Anderson, they had been doing proton radiation therapy for 16 years. The first denial came from Blue Cross. They said it's experimental. Okay. So then they came and they said, oh, you can go do regular radiation first. This is actually in the letter. You can do regular radiation first, and if that doesn't work, we can come back and do proton radiation. Once you do one round of radiation, everybody in the room knows you can't go back and do proton radiation. So then you have all of the collateral damage. And I was at MD Anderson with dozens and dozens of people that had regular radiation at the same time I had proton radiation. Invariably, way over half of them had to have feeding tubes. They had long-term effects that I didn't have. And so it's just a bad system, and proton radiation is fantastic. But once again, going back to my doctors there, they did all these studies because they wanted proton radiation approved. They were helping me, but they also wanted to help proton radiation. You know, and then there was a lawsuit that my firm didn't handle, but we assisted in Oklahoma, which was not ERISA, to show you the difference it can make under ERISA. The jury awarded $50 million because the lady died. Oklahoma Blue Cross the next month put proton radiation on the approval list. Would it have happened? I don't think so. But as long as an insurance company, and I'm singling out Blue Cross in my article, but it's on every insurance, as long as there's no hammer over their head, they're going to deny claims. There's a bunch of studies I thought you might find really interesting on the denial rates or the turn down rates from insurance companies. Consistently, it's a minimum of 25% a year. In some cases, it's as much as 30. In some cases, it's 35%. We had some whistleblowers contact us, and they're instructed that they're only to spend 3 minutes reviewing a claim before they disapprove it or approve it. Now, how can you look through a volume of medical information that you doctors and nurses have provided in 3 minutes and make an intelligent decision? If you think I don't like insurance companies, and if there's an insurance representative in here, you're right.
We don't invite them.
Think about this. How many people have you treated that got frustrated because their treatment had been denied? A lot of people have literally died from that because they give up and mentally they're whipped, and then they don't go to treatment at all. They say, well, my insurance company is not going to pay for it. You know, now most people fight in every last breath, but there's a certain segment of people, once they get turned down several times, they give up. And that's bad. Also, we need you guys to be treating people. We don't need you to be spending hours and hours having your staff trying to get approvals. If you say something needs to be done, damn it, it ought to be done. That's why we pay insurance. How much cost would it save if you didn't have to, the bigger offices, if you didn't have to have a whole staff working hours doing nothing but insurance and dealing with disapprovals? And I mean, it's just not fair. It's not good. It's not a good system. Without your help, patients would have no luck overturning insurance denials. They can't write reports. And see, under ERISA, they're presumed correct. But then they have this team of, quote, doctors who review it and back up. 98% of the time, they back up the denial from Blue Cross. talked to one doctor in connection with my litigation, and I said, well, how many times did you review claims in a year for Blue Cross? And he said, over 200. I said, and how many times did you overturn Blue Cross? He said, oh, at least 2. I said, doctor, and I probably could have got in trouble with the judge. I said, doctor, we have a name for you, and it's not very nice. But 99% of every physician, every cancer doctor, every cancer provider, every nurse is so invested in their patients. I mean, it's great. And thank you. All right, what do we do with ERISA? We need to repeal ERISA. It's a 1974 law, and what it basically says is that we are the deciding factor. We are the arbitrator. So what happens is then you can go through an appellate process, and it's usually a 3-step process. Well, at the end of that, they then can bring on additional information against you. And remember this, under ERISA, they are presumed correct. Okay? So the burden is not beyond a reasonable doubt. It's not by a preponderance of the evidence like it is in state court. They are presumed to be correct. It is a tremendous burden to try to overcome that in litigation. Most lawyers will not handle an ERISA case. I looked at some statistics. Out of every 200 ERISA cases filed, 5 of them are won. Okay? That doesn't mean that I was a better lawyer or Mr. Corkin was a better lawyer. It just means we had better medical evidence that the judge couldn't ignore and had to rule in our favor. Now, to show you how wonderful they are, we go through a 5-year legal process, right? We finally win, and under ERISA, all you get are your actual medical bills and attorney fees. So Blue Cross says, okay, you won. We're going to pay you $35,000. I said, what? And they said, that's what we would have paid under our managed health care with MD Anderson. And I said, but I paid $100. So we had to go back to court, go back through the whole process, and the court said, no, you got to pay the full amount. What do we do with ERISA? We can't correct it as it is. If every group, and I've talked to our senator, Senator Cassidy and Senator Kennedy, and they say, oh, it's a bad law. And I said, well, why don't y'all do anything about it? And they said, well, when a law's been on the books since '74, it's really hard to do anything with it. I talked to Chad, and he was saying that you guys passed a couple of fantastic laws in the Louisiana legislature this year. And then they found out that the laws didn't have any teeth because they were preempted and federal law overrides state law when it comes to ERISA. In other words, federal law overcomes medical decisions, right? All right. So if we don't have ERISA that we're sitting there fighting and we have a fair system in place, I can promise you the insurance companies are going to get right. If you have a patient that's denied erroneously, and that patient can go in their local state court, then they can get an injunction to mandate treatment immediately. They can go in there and file suit. And if the laws were set up properly, then they could get punitive damages or double recovery, even on insurance-related claims, okay, hurricanes that we've all had in Louisiana. If the insurance company doesn't pay, they have to pay double plus attorney fees and penalties. You know, even if you don't want to hit them with punitive damages, at least you have to have a penalty that makes them want to pay the claims. Groundbreaking cancer work is what you guys do and what you know. But anytime you're doing a new project, if you will, a new procedure, new research, it costs money, right? Because you have to develop it. And somebody has to pay for that. And these patients can't pay for it without their insurance. And the horror stories are just up and down about it. You might get a little kick about this. During my treatment, we came across some promotional pamphlets from one of the consulting firms in the insurance industry. And in it, they said that what they did was they looked at all of the radiation treatments and all the cancer treatments, and they came up with guidelines to help their members to fight cancer and to have clinically appropriate radiation therapy. And then they come in there and they say that how bad certain radiations are, and proton radiation is ineffective, and this is why, and we don't recommend it, and boom. 3 years later, that whole study has been thrown out, and proton radiation benefits are approved. But in the meantime, how many people were denied treatment? How many people couldn't afford it? So what we find happening, and you may agree or disagree with this, you are the ones that are saving people's lives. You're the ones that need to decide what kind of treatment. But when an insurance company is telling you this is all they'll approve, they're directing the medical treatment. In effect, they're telling you what you can do or not do, because the patient has to be able to pay for it. I mean, what's the system to have Medicaid, Medicare cover everything and everybody? I don't know. But I know a system where an insurance company can dictate to a doctor, can dictate to a healthcare provider what they can and can't do is not a good system. It can't be a good system. You're the one on the front lines. You're the one that know what they need. You know what they can tolerate. You know what meds they need. How many times have you prescribed a med and had an insurance plan call you and say, Doc, we can't approve that. You got to use a lesser van, or you got to use a lesser this, or you got to use a more, and you know that this medicine is the right one. But you're not going to leave the patient without some medicine, right? So what are you going to do? You're going to do what the insurance company will approve. That's wrong. I mean, you are the front line. You're our saviors. You're the reason I'm alive. ProPublica showcased my long, hard battle with ERISA. They ran another story, though, right after that, and it was about insurance companies flagging expensive claims for special scrutiny. And they did a big article, and I invite you to read it, but they went in there and delved in is that when a treatment, and cancer treatment tends to be some of the more expensive treatment, that they have a special process for denial on expensive treatments. You know, if you go to get your little local flu shot or whatever, okay, we're doing that. But if you're going for extensive cancer treatment or some stem cells or, you know, some of the new IV stuff that you're using, they have a special segment that looks at those and denies them at a 40% rate. Once again, it's horrible. It's not good, and it harms the patients. And then I go back, because I really want you guys on board to try to help me fight this battle. What are you to do as a healthcare provider, as a nurse, as a doctor? What are you to do when what you're recommending you can't do? I mean, I don't know the answer to that. I mean, you face it every single day, but it's a situation you should not be put in. We get rid of ERISA, and I don't think we're going to be put in it. Now, ERISA covers 70% of every group policy in America. So this is not some isolated incident that you have to deal with ERISA. Chances are, if you have a group insurance policy, you are under ERISA. You know, I asked this guy that did the ProPublica article, I said, why me? I mean, why is this of any more interest? And he said, because I looked and I couldn't find anybody else that had won an ERISA case. And I said, oh, hell. I'm going to stop for a minute and I'm going to continue, but I'm going to open it up right now if anybody has any questions. I like to have the audience, if you have any questions. If you don't, I'll continue. But if you have any questions, yes, ma'am.
Is the best way to attack the ERISA and to fight it in the court system? Like, is it the senators? Is it healthcare? Is it physicians? Is it nurses? Is it us bombarding their offices with letter after letter of inappropriate diagnosis? Of course, we don't honestly have the time for that, but realistically, what is the proposal to attack that?
Well, ERISA is a federal law that's been on the books since 1974. It's going to take an act of Congress to repeal that law. But just think about this. If every cancer doctor, every healthcare provider in America said, we're not putting up with this anymore, we're not going to do this, guess what? Everybody in the Senate, everybody in the House has had somebody with cancer. Everybody's dealt with this problem. And if we collectively, and not just in Louisiana, but nationwide, say, we're not putting up with this anymore, we're not going to handle this for these patients, you know, guess what? It would get repealed. The problem is cancer, and I'm a prime example. We know there's tremendous amounts of cancer, right? But you name me one person that's ever come in your office, or any of you that are cancer survivors in here. Did you ever think, really, did you think, I'm going to be the one to get cancer? No. You think, that's for somebody else who's going to get cancer, right? So until it happens to you, you're not that concerned about it. Oh, well, you know, ERISA loves cancer patients. Well, I'm not going to get cancer. I don't need to worry about this. But you see it every day in your office. You see it almost every minute of every day. And that's how we have to deal with this. And then we put some reasonable laws on the books, you know, that deal with insurance and insurance coverage and eliminate ERISA. I promise you, if all these 5,000 people that contacted me, they all had legitimate gripes. If they could have filed suit in state court, you would have seen a change. Look what happened in Oklahoma. They approved proton radiation 30 days after this. Look what happened in Louisiana. And I'm certainly not saying it's because of my case, but after my case and the publicity, they approved proton radiation in Louisiana now. So that, to me, is the solution. But, I mean, you don't have time. I understand you're fighting for people's lives. You're working 14, 15, 16 hours a day. You don't have time to go, well, I got to get a hold to my senators. I got to get a hold to my reps. But your organizations can. The CAGLAs of the world can. The medical societies of the world can. Because, see, right now, the Chamber of Commerce, the insurance industry, I mean, they're all fighting any changes because ERISA is the greatest thing ever happened to them. Yes, ma'am.
I work at LCMC, and we have one girl who does, excuse me, all the authorizations on a day-to-day basis. It's so overwhelming for her, and I think that that's maybe the targeted area you can go to. Every facility here has a person who authorizes, and they could get numbers on what it is or what it is not.
Yes, ma'am.
Yeah, thank you. I totally commend you, one, being here, and two, helping us be an advocate for these patients. I run a rare cancer program this happens to us every time. I have written more appeals and gotten them denied because it's not in any medical policy. Blue Cross Blue Shield's really vague about it. And so that from one moment to the next, people have no coverage. So we deal with the disease that Steve Jobs died of. But I think Steve Jobs could have been like you. He was going to get whatever care he needed, but we all live in Louisiana, where you're trying to fight for people that don't understand, exactly like you said, don't understand the appeal process. So this is also a bigger thing, although totally get on the soapbox of ERISA, is that from one moment to the next, CMS dropped our subspecialty drug, our standard of care drug, off of Humana's formulary. So all these people going for open enrollment, we didn't even know what was happening. So from one moment to the next, January 1st, probably we see around 2,400 patients a year, probably close to 800 patients lost coverage because they have managed Medicare. So then, yes, we're appealing, and yes, we'll shift them on to a non-Humana care, but it's really brutal. And so I think if influential people like you can get in the fight, I feel like we actually have a chance to truly advocate for people that have no voice.
Thank you.
Sorry.
Yes, sir.
So
That's-
I think good idea. If we're going to repeal ERISA, it's going to have to be replaced with something, right?
Right.
So who is the best person to write the next law? And then maybe we can, through CAGLA, through ASCO, through RTOG, whoever, through all of our organizations can push it nationally, because this is not something Louisiana is going to fix by itself.
Who's the best person? to
Who's the
do it?
best person to write it?
Would every doctor and healthcare provider raise your hand that's in here? You are. You're the one that know what we need. You know what the treatment should be. You know what the guidelines should be. We need to have your organizations weigh in and say, this is what's manageable in my office. You know, if you have an office of 10 people, what do you have? 4 people doing nothing but insurance? 3 people? I mean, all day long, every day? So, I mean, that's what needs to be done. And then the nationwide organizations need to say, enough of this is enough. And if the people in the country, and there are millions of them out there, have an opportunity to weigh in and get involved, you know what it is? I think everybody feels so damn helpless in this situation. They're fighting for their lives. And they go, it's a big insurance company. You know, what am I going to do? I can't do anything. I'm just at their mercy. And it affects their mental health, too. How many people do you treat that you're having serious physical injuries, right? But isn't the emotional part, the mental part, just as difficult for you to treat? And don't they feel hopeless when you have to tell them? Because they usually hear it from you first, right? Your office calls and says, I'm sorry, we recommended this, but you were turned down. Right? Aren't you the ones that normally are the first line of having to tell people this? And what do they say? Doc, nurse, healthcare, what do we do? What can we do? And you're as helpless as I felt in the situation. But I'm just too damn hard-headed. I said, let's go.
So let's keep up with the let's go. When you look at the House and the Senate and the Health and Welfare Committees they have right now, in your experience now, do you have a champion that you think we could pull in each one of those committees, run 2 separate bills, run a bill that can be co-authored? What is the strategy? Because I feel like you've got enough of an audience to start here, and we've got Chad. And so the difference is that telling us who you've had the experience with that you think we should go after and pushing them to author that bill, I think is something that we can start doing. Like, that's something we can offer. Even if they turn us down the first time, right? But having something in place and having people we're going to start to target kind of would be the first step forward. Am I right? Is that okay?
I totally agree, because right now there's about 40 to 45 senators on board with repealing ERISA, and the rest of them are not. And that's because the Chamber of Commerce is lobbying them so hard against it, and some other the insurance industry is
strong.
But,
let's label them. Let's label them and let's go after them. Let's expose them.
Check this out, all right? If you want to know how many people are rejected in the state of Louisiana for insurance, right? Those stats are available, but you can't get them. You know why? Because they put a confidentiality deal with the state, and you can't get it. Now why is that? It's shrouded in secrecy.
So you had 44, you said, that would say yes.
Yeah.
Would any of them be the author or co-authors of such a bill?
Yeah, there's several that would author the bill if they thought they had a chance to pass it. But it needs the people don't like lawyers. We're trial lawyers. We're bottom feeders. They don't like us. They love you. It's got to come from you. And I'm saying it in a jest, but you know exactly what I'm talking about. If you ask 100 people, what do you think about trial lawyers? What do you think about doctors? Yeah. So if it's coming from you and not us, you're going to get 10 times better audience, Troy.
Yes.
It has to come from, I mean, I'm serious as I can be. This is so dear to my heart, and I want to see it done in my lifetime, but it's got to come from you. The lawyers that come with this, they're going to say, ho, 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 boy, they want to get rid of ERISA where they can sue everybody and get punitive damages and put these poor insurance companies out of business. The hell with them. That's what, I mean, that's the thought process, right? Mm-hmm. But when you come with it, and they go, "Ooh, man, these doctors are tired of this. We got to help them out. We got to help them treat their patients as they see fit."
Right.
I mean, you can be, let's say Dr. Fuller's a great radiation oncologist, okay? But can he treat your clients, patients, as well as you can? No. Why? Because you're there with them. You're dealing with their issues. You're looking at their medical records. You're looking at their history. You are the person that is trying to save their life. I can't emphasize enough how important you are. And I know this is not something you really want to tackle because you got so much on your plate. But man, God knows this is worthwhile, Chad.
Yeah. Well, every one of us here is a member of associations and societies, right, that can at least, they'd have staff to do such a thing. So I think the key is you know, from Louisiana, little old Louisiana, like I said, we've got a Chad, maybe the option is to push the associations to form an opinion on a bill and use your 44 to start with the process of who's going to push this and author that bill and start to expose the people that are not willing, right? I mean, we got to leave here today with a step forward in this fight. Yep.
Were you eavesdropping on me and Skeeter's call 2 days ago?
No, but I figured. I knew you too long.
Anybody else?
I think the key is to expose the people who are against this concept. Let the public know, let the rest of the country know who's not on their side. I mean, that'll get somebody's attention, I would think.
But it's real easy to do. You send every one of them a letter from your association and you say, we want to go with this bill. Are you in favor of it? Yes or no? And pin them down from the start. They're used to getting letters like that.
Ah.
Yes, ma'am.
What does ERISA stand for, and can you spell it?
Yeah.
I'm trying to Google it, and I couldn't find it.
I will give it. It's E-R-I-S-A.
E-R-I-S-A.
Mm-hmm.
What does it stand for?
I'm going to give that to you because it's
Employee Retirement Income Security Act.
It's the Employee Retirement Income Security Act. It was passed in 1974. And what it was set to do was to make an insurance company a fiduciary of these group plans. When it was put into play, it was supposed to be put in where, you know, they're your fiduciary. They look after you. They make sure you get the health care you need. And it was a great idea. But the way it came about and what it ended up didn't end up one and the same. Yes, ma'am. I'm sorry, I thought somebody's hand went up. Okay.
Who?
Thank you. This is great. Thank you so much. For those of us who aren't physicians in the room, what can we do to help?
You can join your organizations, your physician organizations, your group, whether it's a Rotary Club, whether it's a Lions Club, whether it's a women's organizational group. You know, and the thing about it is, you know, we can literally come up with thousands, hundreds of thousands of examples of these people in this room right now could probably come up with 10,000 examples of problems they've had dealing with insurance or treating their client, patient.
Skeeter, I'd continue to let you talk, but I heard some whispers of some of our board members saying that they might want to take a vote to vote me out as president of CAGLA and make you the president. So for selfish reasons, I'm going to say thank you so much.
All right,
you did a phenomenal job.